Welcome to the Holistic Plastic Surgery Show, where we dive deep into the hottest trends in health, beauty, and cosmetic treatments. I'm Dr. Anthony Youn, America's holistic plastic surgeon. Have you ever thrown your back out from something as simple as sneezing or lifting something light? You may have been seen by a doctor afterwards and been put on NSAIDs and muscle relaxers and told to rest. Or maybe you're one of the estimated 100 million Americans who suffer from chronic pain. Pain that persists long after the original injury. Well, x-rays and other tests may not reveal anything abnormal, yet your pain is real and it's never been cured. Well, if any of these apply to you or someone you love, then it's essential that you listen to this week's podcast. I'm joined by one of the country's foremost experts in treating pain holistically, and together we'll reveal to you the root cause of your pain and how to treat it without medications. So let's get started. My guest this week is a doctor of physical therapy, nutritionist, functional pain science expert, and the author of the #1 best-selling book, Heal Your Pain Now. He is known for integrating brain science, nutrition, emotions, and movement into easily implemented treatments for lasting pain relief. My guest's mission is to quickly and compassionately heal your pain and reverse the global pain epidemic. He is the host of the Healing Pain podcast and runs the Heal Your Pain, Heal Your Life pain relief online program. His goal is to teach you how to retrain your brain and body so you can live the joy-filled and pain-free life that you deserve. I'd like to welcome my good friend, Dr. Joe Tatta, to the Holistic Plastic Surgery Show. Well, thank you so much for coming on the show. It is definitely a very interesting topic that we're going to cover today, and I think it is so appropriate because of the amount of people who are on narcotic pain medications. And as you know, Dr. Joe, that there is this opioid epidemic out there, and I believe that the message that you have is really a huge solution to that.
Great. Thanks, Dr. Youn. I'm really excited to be here and to chat with you about everything from pain to pain medication and how obviously we can help people.
All right. Well, let's kind of get started because, you are a specialist in treating people with chronic pain. You've written a book called Heal Your Pain Now. You have a program for people to heal their pain and to treat their pain without narcotics and these pain medications. How did you get onto this track? You're a physical therapist. You've got a PhD. How did you get there, and can you explain why it is that pain is such a hot topic for you to focus on?
Yeah, I mean, my path toward helping people with pain really starts when I'm quite young. I watched my mom go through basically a health crisis in her life. She was an oncology nurse who worked the night shift. So she worked probably from about midnight to 6, 4 or 5 days a week. So she was really burning the candle at both ends. During the day, she'd take care of me and my brother in the house and all the things that super moms do. She did it wonderfully. And then at night, she would work the oncology floor, and she would obviously take care of kids who were, at that point, this is in the 80s when we didn't have such good cancer care and cancer medicine. So a lot of the kids were terminal. So she was burning the candle at both ends, and she wound up having her own health crisis. So she wound up with chronic back pain and neck pain. She wound up with digestive issues. Mm-hmm. She kind of bounced back and forth between anxiety and depression. And a lot of the symptoms and signs that I just described are very common in those who have chronic pain as well. So chronic pain is not just what you feel in your body, but it becomes this entire experience that involves your thoughts, your feelings, your emotions, what's happening in your body, what you're feeling in your digestive tract. All of this really plays a part. So that was really the first precipitous. What was interesting to me about my mom's experience is that she healed herself naturally. So as a nurse, she had some, pretty good information, if you will. Yeah. So she chose not to go down the drug route. She chose not to go down the surgery route. So she healed herself naturally. And I watched that, and really it became, an inspiration to me in a lot of ways.
So you're treating patients now kind of from a holistic perspective, which I think is fascinating. But before we get into that, let's go into the different types of pain, because people who are listening may say, oh, I don't have pain. I haven't had surgery. I haven't broken a limb. Why might this actually apply to me? Because I think that people who actually have chronic pain, a lot of them haven't actually even diagnosed themselves at that, because they just it hasn't really crossed their mind, even though they are taking maybe ibuprofen or even narcotic medications every so often. They may think, oh, well, that's pretty normal. Everybody takes Celebrex a couple times a week, right?
No, they shouldn't actually take it a couple times a week, because it can actually be very damaging for certain parts of your body. One, your digestive tract, and two, your cardiovascular system. So we have really good research on both of those. We could talk about that in a couple of minutes. But, I think where you're heading, Dr. Youn, is that there's a difference between acute pain and chronic pain. Acute pain is the pain we all know. It's pain that happens from an injury, whether that's, let's say you fall and you scrape your knee, that's a small injury, or whether you fracture a bone, that's obviously a larger injury. With acute pain, there's been some type of tissue damage. And your body has a wonderful ability to heal that damage. It's called the inflammatory process. And it does that within the matter of 2 weeks to 3 months. So obviously that little cut will be healed within about 10 to 14 days. And that arm that's fractured usually takes anywhere between 6 to 8 weeks. Now, as your body heals that injury, that swelling decreases, the inflammation decreases, and your pain decreases. And eventually you go back to life and everything is hunky-dory and you don't worry about pain. Chronic pain is something that's very, very different. So chronic pain is pain that persists beyond that normal healing time. So beyond the 3-month period of healing. And obviously you work with patients who have surgery, and you'll tell them, look, within probably about 2 to 3 months, you're going to be completely healed. Everything will regenerate, because we know that all tissue regenerates within about 3 months. So if pain continues beyond that 3-month period of time, it's termed chronic pain.
And I think there are so many people, I mean, in my experience, I have never thought of myself as, oh, maybe I'm a pseudo chronic pain patient. But yeah, I mean, I operate, and every few months, my back gives out, or that's how we describe it, even though it's not technically giving out. There's nothing going out in your back.
That's right.
But like a lot of my friends, I think, I tell you, as guys, we get together, we'll play hoops or something like that, and we'll talk about it. It's like, oh, this person hurt his back last week, and so they were on the couch for a week, and then, oh, my other buddy said, oh, yeah, that happened to me 2 months ago. So there is a lot more of this out there than I think we realize. And so when this happens, what do? We stretch, we take medications, but there's so much more to it than just that. And I think it's this topic, this idea that you bring about in your book, in that pain is actually an emotion. And that's a huge part of the whole pain process. Can you explain what you mean by that pain is an emotion?
Yeah, so we can go to the definition of pain. Pain is both a sensory and an emotional experience. The sensory is the thing that we know well. It's the tightness you feel, it's the tension you feel, it's the pain you feel. The emotional part is what happens from you experiencing that sensation. So some people could say, okay, I played basketball, my back's a little sore, no big deal, I'm going to do my stretches, and I'll be fine probably within a day or two, and their pain will decrease. Other people, pain becomes this emotional experience where they get anxious over pain. They become very depressed or saddened by pain. They become very fearful from pain. And when those emotions come into play, it actually makes your pain worse in intensity, as well as the duration. So if you hurt your back, so let's say you and your buddy both hurt your back playing a sport, you may say, oh, I'm going to go see my physical therapist. I'm going to do the stretches that my therapist showed me a couple of years ago, and I know I'll be better probably within about 24 hours. Where the other person may say, well, my dad had awful crippling back pain, and he was on unemployment. He never worked a day in his life after that one back incident, and that person may spiral down into a very different scenario in their head. And what's really interesting is that our thoughts really are the one thing that can lead to that emotional experience. So if your thoughts are negative, if your thoughts are fearful, we know that fear is probably the most important emotion when we look at your experience being tied to pain. And Buddhists knew this probably over 2 centuries ago, where they know that pain is one thing, but the suffering that's attached to pain is something that's very different.
And what really, I think, for me, from a personal perspective, several years ago, I read Dr. John Sarno's book about healing back pain, and it really was life-changing for me, because I went through medical school and I did family practice rotations and things like that, and people would come in with back pain, And we would treat them with NSAIDs. We give them Flexeril, muscle relaxers, and then maybe we would refer them to a physical therapist to do some stretching. I read this book, and it really kind of puts all of that on its side, and it says, a lot of this pain is in your head, and it's like a psychosomatic issue. It's caused by your brain. And think about stress. And one of the things that happened to me, about a year or 2 years ago, is we had a huge snowstorm here in Michigan, which happens in New York all the time, where you are too. And this day I said, look, I told my employees, stay home. I'll take care of things in the office. And it was incredible how many patients were calling and coming in, even on this day where everything was closed because it was so snowy. And I remember I lifted something literally about 5 pounds, and boom, my back went out. And I remember I was super stressed, and then I could barely stand. I was having terrible pain. And I thought, oh my gosh, that's what it is. This is completely psychosomatic. This is my head creating this stress, and it's manifesting itself in my body. And I think that's something that people don't really realize, and is a part of the message that you're sending out as well, is that when you're having pain, there's so much more to it than you may think. It's not just, oh, look, you tore a muscle. Well, you didn't tear a muscle. That's not necessarily the case.
That's right. Most people with chronic pain have no observable injury, so you can't really see anything on an X-ray or an MRI that can diagnose them. And even the things that we see on X-rays or MRIs, like herniated discs, like degeneration or osteoarthritis, most of those scans poorly correlate with someone's symptoms of pain. So basically it means that if you take an X-ray of 100 people's backs, most people are going to show some type of change. I want to use the word change versus degeneration, because change is a much calming and a much less dangerous word to use. Most people will have change on their MRI. And I tell people that we gray on the inside, just like we gray on the outside. It's a normal part of life. And most people won't have any types of symptoms. So when you talk about this experience, your own experience, and pain is like a puzzle. So to help you put together your pain puzzle, you said, okay, I'm going to go and I'm going to handle everything today on my own. I'm going to handle the snow. I'm going to handle all the patients. I'm going to handle the phone calls. I'm going to handle the surgery. Everything, in lack of a better word, was on your back, so to speak. So your stress level was increased that day. And your body let you know that, okay, we've had a couple of danger signs here, meaning that I shoveled the snow, which I did something physical, that I had stress in my life, that, I can't handle the patient load that day. So all that stress level finally came to a tipping point, and your body lets you know by producing pain. Sometimes it's back pain for people. Sometimes it's a headache. Sometimes it's knee pain. We all have different parts of our body that respond based on our past experiences, based on our past beliefs, and based on our thoughts, either currently or our thoughts from the past.
So do you think then, as we get older, that because we develop more experiences, that we have a greater tendency as we get older to develop this type of pain that's based off of emotions and prior experiences, a lot of it being psychological? As we get older, is that one of the reasons why maybe as people age, they do tend to seem to have more issues with pain? Or do you think there truly is a physical, real manifestation here as well? You know what? You're getting older, you're going to have more pain.
Well, so pain is what they call a biopsychosocial phenomenon. That's a really big word. So the bio is what's happening in your body, the inflammation that's there, how the joint is moving, how strong you are, how flexible you are. The psychosocial is kind of what the other points we're talking about. Now, when you talk about aging, that's really a social phenomena. So if we look at how different societies look at aging, in the West, we kind of look at aging almost as a negative thing. As you get older, you're going to start to break down. You're going to wear down. You're not going to be as quick-witted. You're not going to be as physical. And the truth is that that's not true. And if you look at back pain specifically, and we look at studies on back pain, most people with back pain, those with chronic back pain, are typically between the ages of 40 and 50. So then they're in the middle of their life. Back pain actually tends to decrease as you get older. And when you look at most of the chronic pain conditions, actually the same thing happens. So we know that oftentimes pain will run its course, but oftentimes we also have to look at what is the message that we're sending as a society to people about their bodies and about pain. What's the message that we as practitioners are sending to our patients? I think when you start to look at a metaphor, we use metaphor a lot when we talk to patients, and there are structural metaphors such as it's bone on bone in there, or your joints are wearing down or they're grinding down. Those structural metaphors and the language that we use as clinicians with our patients and the language that our patients use to describe their pain experiences are really important. And if the language is more toward the negative slant, like it's bone on bone, then your language has a way to actually cause inflammation in your nervous system. But if you change that language to, well, these are just kind of the kisses of time, or even though I have some signs of wear and tear, I'm aging like a fine wine. If you start to change those metaphors and that language around, it does some really powerful things to help people get over their pain experience.
Yeah, I love that. The whole I'm aging like a fine wine. I think that's great. So now you're getting kind of into that idea that you bring about in your book called central sensitization. And a big word, but I think a very profound subject that I would love to have you elaborate on.
Yeah, central sensitization is this concept that your nervous system is in this wired state. It's hypervigilant. So I think of it like someone stuck their finger in a socket and their entire nervous system has all this electrical charge running through it. It's hypersensitized. And this happens with chronic pain. So oftentimes these negative thoughts, they're known as pain catastrophizing, make the nervous system wired. So these are thoughts that I'm always going to have this pain. This pain is never going to go away. This pain is going to be the death of me. It's like a knife is stabbing me. Or I have this splitting headache, which might envision maybe an axe, going down the center of someone's head. Mm-hmm. All these types of words, and oftentimes our thoughts also lead to images. So you really have two things happening. You have your thoughts, and you have the images that you hold in your brain, in your nervous system, and they can actually cause what's called Neuro Inflammation. They can cause inflammation within your body to actually happen. So a lot of what I focus on are reframing people's thoughts, reversing these negative images, mm-hmm. and working with people in a way that they start to see, okay, this is not actually how my body is, that I have the power and I have the influence over my own body, and I can actually make myself better. I think the image of a herniated disc probably is the best when we start talking about central sensitization. So if you go online right now and you Google herniated disc, mm-hmm. images on the internet will come up of this kind of big plump disc with this big red part that's pushing on a nerve. And it's very visual. And it gives people the sense that, oh my God, in my back, I physically have like something pushing on the nerve. And the truth is, Tony, you and I know this because we've been through cadaver dissections in school. The truth is that's not what it looks like. Mm-hmm. Your disc does not look like that. And in most instances, your disc is not pushing on the nerve. There is a number of different factors, because pain is multifactorial, that are contributing to your specific pain experience.
Yeah, and so you're finding too that this idea of central sensitization, where your brain is taking what is essentially a stimulus and kind of exploding it into these other types of problems, can even lead to issues more than just what we would consider kind of traditional pain, but people who also have issues with fibromyalgia, people who have issues with irritable bowel syndrome. You're finding these other types of physical manifestations of these essentially neurologic issues, correct?
That's right. So pain is only one output. So when your brain feels like it's in this harm state, it'll create pain to warn you. But believe it or not, your brain can also create swelling, even when there's no injury. Mm-hmm. Your brain can create other sensations like numbness or tingling or pins and needles. There are many, many different sensations that your brain can create as a way to kind of alarm you that there may be something that's actually damaging you, like that broken arm, or there may be something potentially damaging you, like your sedentary lifestyle, like nutrition, or like the thoughts that we've talked about in the podcast so far.
And there's a story, I think, an explanation that you gave in the book that I thought was really eye-opening and explained it, I think, so well, about the idea that so much of the pain is really in your head is neurologically mediated. It's mediated, by your brain. And it's the story that you give of, okay, if you're crossing the street and you twist your ankle, you have a certain reaction to that. But if you're crossing a street, you twist your ankle, and then you see your child about to get hit by a car, there's a very different reaction there. Can you describe this whole idea? Because I think this is a great way to explain just how the brain can alter how your body, how you actually feel pain.
That's right. So I look at the brain like a big satellite dish, and it's taking in all this information. Now it's going to decide, okay, what's the one piece of information I should pay attention to the most? So if you sprain your ankle and there's nothing else going on at that moment, it's going to pay attention to that sprained ankle. But if you sprain your ankle and you see that there's traffic coming at you at the same time as you cross the street, it's going to say, okay, what's the most dangerous here is the traffic and not my sprained ankle. So your brain makes the decision on what the biggest danger sign is. Conversely, if you have signs of safety in your life, like you have supportive relationships, you know that when you exercise, it makes you stronger and more flexible. It also helps increase natural endorphins in your body. Those are signs of safety. And when there are more signs of safety versus signs of danger, your body lowers that danger signal. And in essence, it lowers that pain response. So I tell people, try to collect all these great, wonderful signs of safety in your life. So supportive relationships, a healthy diet, a healthy lifestyle, exercise, positive imagery, positive thoughts, positive emotions, positive feelings. When that big satellite now takes in all those safety messages, you now have a sense of calm. You have a sense of less fear, of less danger. And with that, your entire nervous system quiets, your entire nervous system relaxes, and you have less tension, you have less tightness, and you have less pain.
So his name is Dr. Joe Tatta. He has written a book. Let me show you here. It's called Heal Your Pain Now. This is a revolutionary program to reset your brain and body for a pain-free life. His website is drjoetatta.com, T-A-T-T-A. And he also has a pain quiz that we'll talk about at the end of the show here, but it's thepainquiz.com. So if you're wondering about what are your thoughts and feelings about pain, and especially the pain you're having now, this is a great quiz to take to really open your eyes to your perceptions about pain. Let's get into now some of these solutions. So we've talked about how pain isn't such just a simple thing of hurt does not necessarily equal harm, mm-hmm. and we've kind of gotten to this idea that so much of pain is controlled by our brain. Well, how then can we then use our brain, and I guess our bodies as well, to treat pain without popping pills and taking narcotics?
So we talked about the negative thoughts, and we talked about reframing some of those thoughts. That's probably step one. Mm-hmm. So as you reframe those thoughts, you will actually decrease your pain. Step two for a lot of people is just starting something that's simple, such as mindfulness. So that could be a mindfulness meditation technique. And you only need to do this really 5 or 10 minutes max once a day. So it could be a mindfulness meditation technique where you just focus on one word, like peace, or calm, or relief. And as you focus on that one word, you will kind of push the negative thoughts out of your head, and you become focused on that one thing. So ultimately what we're doing is we're reframing those negative thoughts, we're pushing those negative thoughts away and focus on something that's positive. The other thing you can try to do is what's called a body scan. So a body scan is a wonderful meditative technique where you close your eyes and you basically just focus on different parts of your body. So let's say I'd have you close your eyes and I'd have you focus, let's say, on your forehead mm-hmm. for a couple moments. And then I'd have you maybe focus on one side of your cheek for a couple moments and see if you can recognize what the sensations are there. And a number of things happen when we go through a body scan. People either figure out that, wow, that part of my body feels painful, or there's a buzzing sensation there, or I actually can't feel this part. I can't identify what's going on in this part of my body. So as you go through a body scan, it helps identify where your body is in space to your brain. Because actually in your brain, there's a physical representation, a GPS, if you will, of your entire body in your brain. And when you have chronic pain, sometimes that GPS gets a little confused. It gets smudged. You can't find certain parts of your body. So when you go through that body scan, it helps identify certain parts of your body, and it makes it more clear and distinct in your brain so that it decreases that pain sensation and it decreases fear in your brain. The other big thing I think we need to talk about is probably nutrition. Mm-hmm. When we look at our society today, we have a lot of people that live in a low, or some people live in a high inflammatory state, and that's oftentimes due to their poor diet. So the groups that I talk about most where this becomes the biggest factor are those that have metabolic syndrome, those that are obese or overweight, and those that have an autoimmune disease. Mm-hmm. So those are the three groups primarily that nutrition can make a wonderful impact in decreasing inflammation. As you decrease inflammation, you will decrease pain. But there's something really interesting about nutrition that no one makes the connection to, mm-hmm. and that's that your immune system, about 70% of your immune system lives in your gut. Now, as you go through this process of reframing your thoughts, as you start to work on meditation, as you start to decrease these negative thoughts, you make new synapses or new connections in your brain. So when one neuron meets another neuron, that's a synapse. Mm-hmm. And that's a new positive thought. But what's interesting is around that synapse, there's an immune cell that kind of glues that together. It's kind of like the super glue of your new thought process. Mm-hmm. So in order to have that new thought process and that new synapse, you have to have a healthy gut, because that's where your immune system is really created. And when you have healthy nutrition, when you optimize your nutrition, that synapse will stay longer and will stick for a longer period of time.
So that's one of the things that you talk with your patients about as well, is looking at nutrition as being one of the helpful aids and for them of reducing their chronic pain. And it's fascinating how so much of it comes down to the gut and the microbiome. I actually recently interviewed a good friend of ours, Summer Bach, about that exact same issue. And I'm finding just in my own practice the importance of that on our skin. And there's so many manifestations that I don't think we even have touched the surface of what our microbiome does to our body and our health. And I'm so glad that there are such forward-thinking doctors like yourself and some of our colleagues who are really focusing on this, because education is such a huge part of that.
Yeah, your microbiome has the ability to influence your entire nervous system. So what happens is, as you eat a diet that's high in sugar, as you eat a diet that's very pro-inflammatory or foods that necessarily don't agree with you, you change your entire microbiome. Mm-hmm. And when that microbiome changes, you increase inflammation not only in your gut, but that inflammation spreads throughout your entire nervous system. Mm-hmm. It actually spreads throughout your entire body. So it can make your joints more inflamed. Mm-hmm. It can make your nervous system more inflamed. It can actually change how your brain absorbs nutrients, specifically smaller molecules like glucose, which your brain needs to energize itself. Your brain also uses fat, though. So your microbiome has a wonderful way to influence everything. And there's no way, in my personal opinion, that you can actually heal yourself 100% from a chronic pain state without optimizing your nutrition.
And we see that too. I mean, several months ago, I interviewed Dr. Terry Walls, this very similar issue about how the food that you eat and the microbiome can really affect autoimmune disease, and just like you said, inflammation. And it does make sense that there's inflammation also in our nervous system that creates this type of pain. So I'm glad that you're spreading that message. One thing I really want to go over with you, because I think this part, I think of all the things I found in your book that was one of the most fascinating to me, is the idea of graded motor imagery. And this is another part of the treatment of people with chronic pain. Because it relates to this idea of neuroplasticity we'll get to in a minute. But can you explain the idea of graded motor imagery, and for those people who are having chronic pain, how this can potentially help them?
Sure. Graded motor imagery is a wonderful technique. It's kind of what they call a psychoeducational technique. So in your brain, there are mirror neurons, they're called. So mirror neurons work or fire when you watch movement. So if you watch my hand, let's say just moving up and down like this right now, mm-hmm. in your brain, there's actually an image of my hand moving up and down. And we can actually leverage the power of those mirror neurons to help you rehabilitate, to help you get better, to help you have less pain. And oftentimes people actually know this is happening, but they're not aware of it. So people will say, let's say you go and you watch a movie that's very violent. And you'll say, oh, I can almost feel that person's pain when they were shot or when they were stabbed. So those are your mirror neurons working. Mm-hmm. Another way we often recognize this happens if you go to a sporting event. People with chronic pain often will see an activity, let's say a sporting event, or they'll see, let's say, someone dancing where they're bending their body into extreme positions. And they'll say, wow, I can almost feel that person's pain. And again, they're imagining those movements in their mind. Now, what we do with people with chronic pain is we have them imagine small movements. So let's say someone has a very stiff hand. And when they stretch their hand like this, it becomes very, very painful, and they actually can't do it, and they want to avoid it at all costs. Mm-hmm. What I have them do, let's say, is start to imagine that joint moving nice and slow at first, and then moving faster and faster, and then eventually moving where they're lifting an object such as a weight or something that's heavy. And when you imagine movements, your brain thinks you're actually moving, even though you're not actually moving. So that's the basis of graded motor imagery. And we use it as part of the rehabilitation process. Oftentimes we use that with the worst types of pain, such as CRPS, which is called complex regional pain syndrome, mm-hmm. or neuropathic pain. Sometimes people develop neuropathic pain after a orthopedic surgery, after any other type of surgery. So we use graded motor imagery as a really nice kind of introduction to movement without actually having the person move.
Yeah, and I find it very interesting because you can also, obviously help treat chronic pain patients because you can kind of get them started with moving those areas without them actually physically moving it. And so I think it is a much less scary starting point for them because they think, oh, if I move it, it's going to hurt. Well, you don't have to. Just do it in your head and then gradually move to the actual physically doing that. And I find it fascinating because it kind of goes that whole idea of visualizing doing things before you actually do it. And a couple of examples for myself, if I have a surgery maybe that I haven't done in a while, or even a surgery that I haven't done before, I'll literally picture myself and my hands performing that operation dozens of times before I actually go into the operating room and do it. And I find that it really helps me.
Yeah. I love that. I think that's what you're doing is incredible, and it actually makes you a better surgeon. And we know this if we've looked at athletes. So when we look at gymnasts and dancers and they have these routines, oftentimes you'll see people on the side and they'll be kind of like imagining the movement. They may be moving a little bit, but they'll actually be imagining that whole routine in their mind. And when you imagine movement, it's equally as good as if you actually do it. So once you then go to start moving, or then you go to start doing that delicate procedure like you do, Dr. Youn, it actually makes you better at it.
Yeah, especially I think if you're doing an action that is very delicate, but you go through as the similar motions over and over and over again. Excuse me, like I do with surgery, where I'll do the same operation 100, 200 times a year. The same way, I think that can really help with that. And it's funny because I think about my children, and my daughter's big into gymnastics, and we see her sometimes at night, and you can tell that she's dreaming about going through her beam routine or her floor routine. And I do think that makes her a better gymnast. And I've got a son of mine who plays Little League Baseball, and the other day he was kind of in a bit of a hitting slump. He's been for a week or two, and I said, just before you get up to the plate, close your eyes and take a few minutes to imagine yourself hitting that ball out of the park, and just take that time to do that. I do think it helps. And I think that there are a lot of people who, like you said, who are professionals in their field that utilize their hands or their body, and they utilize this whole idea of their own type of graded motor imagery or neuroplasticity to impact their ability to perform the task that they're going to do.
Yeah, it's also using imagery in a positive way. There are other ways you can use imagery. Like oftentimes people describe their pain as burning. Mm-hmm. And I tell people, okay, let's start to reframe that a little bit, because burning makes you think that if your skin is burning or a joint is burning, mm-hmm. it might make you think that some kind of tissue is being destroyed. So it's a big danger signal. So I tell people, when you go to the gym and you start to exercise, imagine that there's water or there's fluid moving through your joint, and that fluid is distinguishing or extinguishing that fire. And that's a very different image than I have burning pain. And I tell people, okay, let's start to use that exercise to increase the synovial fluid, the natural fluid that your body has in your joint. And as you increase that natural fluid, you will extinguish the fire in there. And that imagery for a lot of people can be really life-changing. And it's something that they really have never heard of before. And oftentimes either they're vocabulary, their language, or the language that, let's say, their practitioners use with them is actually the opposite. So I start them down a very, very different path that can help them heal.
Well, his name is Dr. Joe Tatta. He's written a book, a new bestseller called Heal Your Pain Now, the revolutionary program to reset your brain and body for a pain-free life. If you or somebody you love has chronic pain, even if you've got issues with, what you may not think, well, I'm not a major pain patient, but maybe I do have back pain every so often, and I miss a few days of work out of it a year. This can be really helpful for you, and it's more than just giving some of these mindfulness types of exercises, but you also give actual physical stretching exercises and things like that that can help. An entire program for those of you who know somebody or maybe yourself are having chronic pain. Dr. Joe Tatta's website is drjoetatta.com, Joetatta.com. And take a peek at his pain quiz. It's called thepainquiz.com, where you can learn about your perceptions of pain and how maybe this kind of getting to the root cause of what your pain issues can really help you to solve those problems. One thing, too, just before we finish with the book, is I'm not a big meditation guy. I grew up in the Midwest, and it just was never something we talked a lot about. But you gave something, and you mentioned it earlier just a few minutes ago, about just a 5-minute mindfulness meditation that I thought was great because, most people think, oh, meditation, I got to cross my legs a certain way, or I'm afraid I'm going to fall asleep if I do it. But just that 5-minute meditation I thought was absolutely fantastic. And you mentioned it earlier where you just take those 5 minutes, you repeat a word over and over again during that time. Make sure you're sitting while you're doing it. You don't want to be lying on your bed because you might fall asleep. But I think that just starting with something like that can really help a lot of people.
It can. The biggest meditation I give to people, and again, 3 to 5 minutes, is one word. I would recommend is either safe, or they could actually say over and over as a mantra, I am safe. I am safe. I am safe. And the reason why that is because when you send a signal of safety to your brain, to your nervous system, you decrease that pain response. And oftentimes people are stuck in the belief that my body's deteriorating, my body's damaged. And as people read my book and they become familiar with my information, finally start to say, wow, I never realized that it wasn't really about my body. It was about this harm alarm that has stayed on in my brain for a long period of time. But I have the ability to turn that around. So just starting with a 5-minute meditation of saying, I'm safe, I'm safe, I'm safe, can be a wonderful way for someone to decrease their pain and anxiety.
Well, I think that's great advice. So his name is Dr. Joe Tatta. Visit his website, drjoetatta.com, and take that pain quiz, thepainquiz.com. Thank you so much for coming on the show. It's definitely been a pleasure. I think we covered a lot of really fascinating topics, and I hope people take a peek at your book. I think you've got so much great actionable information in there. I would highly recommend it.
Thanks, Dr. Youn. It's been great here chatting with you.
All right. Well, we'll see you next week. I'm Dr. Anthony Youn, America's holistic plastic surgeon. Thank you for watching the Holistic Plastic Surgery Show. Do you want to look 10 years younger without having surgery? Well, my best-selling book, The Age Fix, will tell you how. I spent the past 17 years learning the secrets to turning back the clock and have written all the best of these secrets in this book. This includes the Age Fix diet, simple changes to what you eat that can make a huge difference in your appearance. I'll share with you a simple skincare routine to keep aging and wrinkles at bay. And I'll share with you the best secrets to treat every single beauty and aging problem there is, from age spots to wrinkles, saggy skin to bad breath, saddlebags to hair loss. And almost all of these can be effectively treated without surgery. So are you ready to turn back the clock and kick Father Time's backside? If so, check out The Age Fix. Now, if you purchase it on my website, dryoun.com, you'll get over $10 off the cover price, free shipping, and you'll receive several free gifts, including a bonus chapter that you can only get by purchasing the book there. Thank you for making The Age Fix such a huge success.